All right, let's get your weight and height. It's about close to 75 kilos. All right, I'm going to get your vital signs now. Over 68. Get your respirations and your pulse. Just pretty normal for me. Respirations. Pulse. Okay, I'm going to start with inspecting your skin. I'm just looking at your skin in your face. I don't see any rashes, no nodules or anything like that. And I move to your hair and I touch your hair. It's not dry. That's a sign of hypothyroidism. Your scalp looks good, no dandruff or anything. So then I'm going to feel for nodules. Do you feel any tenderness? Mm-mm. Okay. All right, and then I'm going to come down and tell me if you have any tenderness in your frontal sinus. Mm-mm. All right, axillary. Mm-mm. Okay. Is that tender in your TMJ? Mm-mm. Okay. All right, and then I'm going to move to your nose. I just want to test for patency. I want you to breathe lightly in and out for me. Okay. So your nares are patent. And then I'm going to look at inside of your nose. Septum, that's in your turbinates, moist pink membrane, and again, no deviated septum. Sorry, make you tickle. Alright, then I'm going to assess your mouth. I'm looking at your lips. You're not dehydrated, they're good and pink. And if you will open your mouth for me, I'm going to assess the inside. Might as well just let these down because. Alright, open wide for me. Alright, I'm looking at the back of your throat. I'm looking at the sides, the roof, the bottom floor of the mouth is good vasculature. I'm see your top of your tongue. Okay, good. It's not dry. Alright, and then we'll move to your eyes. And we're going to do the uncover cover test. And what that does, it tests for alignment and it's to see if your eye compensates for the other. It will compensate if you have misalignment, and you do not. No, that's good. Another one is a reflection test. I'm going to shine the light on your eyes, and the reflection should be equal for alignment. Yep. All right. Then we're going to do an ophthalmic exam. So I'm going to get really close to you, and I'm going to look through this and find your red reflex, and then I'm going to come in really close, and I'm looking for the malleus on the back of your eye, the macula, your vasculature, and your optic disc. Your optic disc, nerve, macula. Over here, and I always have a hard time with this eye. his macula, vasculature looks good. All right, then we're going to move to the ears. And I feel tenderness in your ear. Do you have any tenderness in your ear? Mm-hmm. Okay, I don't feel any nodules or anything. And then we're going to inspect the inside of your ear. Tympanic membrane, mucus, and malleus. Let's see your tympanic membrane, mucus, and malleus. Looks good and pink, it's not red. Got a little cerumen, but that's not. Alright, now we're going to do test for lateralization. What I want you to do is tell me if you hear this in both ears or just one.
Both.
Okay. Next I'm going to do a Weber test, and that assesses air conduction to bone conduction. Tell me when the bone conduction stops, and then tell me when the air conduction stops.
Stop. Stop.
Okay, that's good. It should be twice as long.
Stop.
Okay. Then we're going to assess your cranial nerves. There's 12 cranial nerves. First one is olfactory, and that is your smell. Let's see if you recognize this smell for me.
No.
Next is optic, and we're going to do the Snellen chart. Normally you would do 20 feet away from the Snellen chart, but this version it's set to do it at 10. So if you'll go to that red line and cover your right eye, and can you read this line?
Yes.
Okay. Go ahead and read it for me.
FBLOPZV.
Okay. Let's go up one. Can you read that one?
Yes. EDFCVP.
Okay. Try this one. One my finger's pointing to.
Yeah. DETFOTEC.
Okay, so you're 2032 in your left eye. Now let's do the other eye and give your eyes time to adjust. Go ahead, yeah. All right, let's start with this one. Where my finger is. Can you read that one?
Yes.
Go ahead.
FELOPZD.
Okay, good. Can you try that one?
No.
Okay, so you're 2032 in your right eye as well. All right, you can come back. All right, and then we're going to do oculomotor. Oculomotor is the muscles around your eye, and the nerve affects that. So tell me if you cover your right eye, cover my left, and tell me when you see my fingers come at you. Do you see my fingertips?
Mm-hmm. No. No. No.
Okay, now cover the other eye.
No. 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 No.
Okay. Now I'm going to put hold numbers out and tell me what number I have, but look straight at my nose, okay?
5. No.
Okay, one more.
2.
Come back in. All right, try it again.
2. 4.
Try this one.
3.
your peripheral vision. I might have needed to come a little further away from you, so that's okay. And then the other one tests 3, 4, and 6. And so what it does, I want you, it's a H test, and I want you to look straight at my nose and follow my finger. Okay, that's good. All right, next is 7, and that's facial. And so I want you to raise your eyebrows, puff out your lips, your cheeks, and close your eyes real tight. And let me see your teeth. Good. All right, facial nerve is good. And then we're going to do acoustic. And I'm going to whisper something in your ear, and you repeat it.
War Eagle.
Okay.
I bleed orange and blue.
Okay. And then next would be 9. And it is glossopharyngeal and vagus. And it is gag. Okay. So, I want you to, actually, I'm not going to make you gag, but I just want to see if your uvula moves. So if you will say ah.
Ah.
All right, say it again.
Ah.
Okay, good. It deviated if you had any deficits, and it didn't, so you're good. Next is 10, 11 is spinal accessory, and that's trapezius and sternocleidomastoid muscle. So I want you to push up. All right, you got good strength. That's good. And then 12 is hypoglossal. Stick out your tongue. Let's see if you move it side to side. Good job. All right, you good. Then when you talk, I'm assessing for 5, 7, 10, and 12. So you talk, articulate, and your voice is fine. So then we're going to move on to your neck. So I'm looking at your skin, and it's clear. You don't have any nodules, no abrasions or anything. I'm going to assess your carotids one at a time. Okay. And then we're going to listen for bruits. And what I want you to do is breathe in and out and hold it. Okay, let's do this again. In and out and hold it. You holding it? Okay, I'm sorry. Okay, you're good. All right, then we're going to do range of motion. I want you to do flexion, extension, rotation, and then lateral bending. Okay, you're good. Then I'm going to assess your lymph nodes. And so we have occipital, postauricular, preauricular, parotid, retropharyngeal, submandibular, submental, posterior cervical, anterior cervical, and supraclavicular. Okay, and then we're going to assess for JVD. Okay, so let me get you to turn around. I'm going to raise this up for just a little. Raise it at a 45-degree angle, and if you'll come back, you assess from the sternal notch, and then turn your head to the left. And if I saw pulsations, you measure up, and the higher on the measurement, the higher the pressure on the right ventricle, which is a sign of heart failure. All right, you can sit up now. All right, now I'm going to look at your trachea, and it is not deviated. All right, if you would take a small drink of water and turn your head to the left and assess your thyroid. Okay, swallow. Oh, do it again. I'm sorry. Okay, swallow. All right, and now let's do the other side. Okay, let me get my finger, please. Okay. Okay, you're good. No swelling or inflammation or anything like that. You're good. Okay. All right, so we're going to go now down to the chest. I would assess, I'm not going to take your shirt off or anything, but you would assess the skin. You would look for any nodules or signs of skin cancer or anything like that. And then I'm just going to palpate for tenderness. Do you have any tenderness around your chest area? Okay. And then I'm going to listen for tactile fremitus. I want you to say 99. every time I place my hands.
99. 99. 99.
Okay, good. That's good. And then I'm going to listen for bruits and pulsations. I'm going to feel for bruits and pulsations. That's typical. Okay, that's good. And then I'm going to listen to your precordial sounds. Actually, let's do measurement of your precordium. Let's do precordium. I'm sorry. All right. Okay. I'm going to do diaphragm first. This is tricuspid, pulmonic, secondary pulmonic, mitral, and aortic. And we do the bell, tricuspid, pulmonic, secondary pulmonic, mitral, and aortic. All right. Now I'm going to go to your posterior. Actually, can you just turn around that way? There you go. Thank you. All right. I would assess the skin as well. I'm going to push for any tenderness. Do you have any tenderness? All right. Then we're going to do tactile femtest for this too. So just say 99.
99. 99. 99.
Okay, that's good. Then I'm going to do respiratory expansion. I'm just going to place my fingers together. Now breathe real deep for me. And we're assessing that my hands move equally, and they did. All right, now I'm going to percuss all the areas. And then I'm going to assess for respiratory expansion as well. So what I'm going to do is I'm going to palpate down, and then I'm going to palpate up, and then we're going to measure it. So if you can breathe in and then exhale for me. Breathe again and then exhale. Let's try that again. Ready? In and out. You can breathe in. All right. Now breathe in and hold it for me. And that should be between 3 and 5, and you are, and so that's about right for the diaphragm. All right. Now I'm going to auscultate. Just breathe in and out for me. All right. Breathe. Okay. Breathe. Okay. All right. Let me get you to turn around. I didn't auscultate the front. I need to do that. All right. Breathe in and out for me. Okay, clear. All right, let me get you to lie down, and we're going to assess the precordial sounds in a recumbent position. Tricuspid with the diaphragm, pulmonic, secondary pulmonic, mitral, and aortic. Now with the valve, tricuspid, pulmonic, second pulmonic, mitral, and aortic. Okay. Now I'm going to assess your abdomen. We're going to do the abdomen area. And so I'm just going to pull this up just a little, and I look at the skin, see if there's any rashes, see if I see any obvious peristalsis or anything like that. Then I'm going to assess for your abdominal reflex. Okay, ready? One more time. All right, you definitely have abdominal reflex. All right, and then I'm going to percuss, and I'm just going to percuss all 4 quadrants. Actually, let me auscultate first. I'm going to get everything stirred up. And I'm going to auscultate. All right, I need to listen to your arteries as well. I'll listen to the aortic, renal, iliac, all right, I'm going to percuss, and we're going to do liver expansion. All right, you ready? So I'm going to come down your abdomen, and then I'm going to come up, and we're going to see the expansion of your liver. Your liver. And then I'm going to come up. And that should be 6 to 12, and that is normal. Yep. All right, so liver expansion. Okay, I'm going to palpate your abdomen. First I'm going to palpate soft, so tell me if you have any tenderness. Any tenderness? Tenderness?
Mm-hmm.
Okay. Now I'm going to palpate deep and try to feel your organs. That would be your liver. Does that hurt?
No.
No. And that is your spleen. No pain. Okay. No pain.
Mm-mm.
No pain.
Mm-mm.
Okay. Your kidneys are difficult to find, but you would kind of catch it in between and try to dig deep, but they're always difficult to find. And you've got very strong abdominal muscles. All right. I don't know if you hit right there. And those are your kidneys. Okay, let's see. All right, now I'm going to move to your arms. You can sit up there. All right, let's do some range of motion and do flexion and hyperextend. All right, and then we're going to put your arms down by your side and put your arms out like that. That's internal rotation of the shoulders, and that's external, and this is internal rotation of the shoulders. Okay, let's do your shoulder full rotation, range of motion. All right, up. And then put your arm, reach behind your back, and that's internal, and then the other arm. Okay, good job. Let me test for light, sharp, and vibration. Okay, so tell me if you feel, close your eyes. Tell me if you feel sharp, soft, or vibration.
Sharp, 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 sharp. Soft, 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 soft. Vibration, 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 vibration.
Okay, let me see your hands. And capillary refill is good. All right, now do your hands like this. All right, and then flex and extend. All right, and then rotate out and rotate in. There you go. That tests your wrist. All right. My camera cut off. It's a manufacturing thing, and I can't figure out how to keep it from cutting off at 12 minutes. So sorry it cut off, but I went and turned it back on, and I'm right back. All right, so we did arms, we did the legs, and let's do sensation on your legs. Go ahead and close your eyes for me. Tell me if you feel pain or softness.
Pain, 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 pain.
And then soft. If you
Soft.
feel soft.
Soft, 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 soft. Vibration, 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 vibration.
All right. And, reflexes. Okay, that's fine. Let's do this brachial radio first. You just twist your arm in and make it flex. And this back in. There you are. There you are. All right. Okay, now let's do the triceps. All right, just relax your arm for me. Nope, no reflex. Okay. There's a little bit of one. All right, and then we'll do patellar. A little bit. All right, good. And then you do Achilles. You just relax your foot. And then Babinski, I'd rub it up the bottom of your foot, and your foot would flex. That would be normal. And then, actually contract. And then same on the other foot, but we won't take shoes off. Okay. Okay. We're going to do stereognosis. I'm going to put something in your hand, and you identify it.
Paperclip,
Okay.
coin,
Okay. All right. Let's do range of motion of your legs. Okay. This is abduct, adduct. All right. Flex your knee, and then hyperextend. Okay. Let's do the other leg. Abduct, adduct, flex, hyperextend. All right, good job. Now let me see you just walk heel to toe and back on your tiptoes. All right. Now let me think if I forgot what all I've forgotten. You can hop back around the table. Okay. Let me think.